Hi, welcome. My name is Dr. Shvetha Zarek. I'm the medical director of Arbor Fertility.
Hi, I'm Dr. Erica Buchalter. I'm the psychiatrist and founder at the InSync Brain.
And we're here for a webinar titled Optimizing Alpha Brainwave Balance for Fertility Success. So we're here to talk about how EEGs and treatment specifically can help fertility patients. But let's first kind of start with the how and the why of it, if that's okay. And thank you so much for having us. So at Arbor Fertility, we believe in kind of providing a full-scale kind of fertility clinic, but at more affordable cost, as well as really trying to take as best as we can a holistic approach and learning about this clinic. And what is the name of your clinic?
The InSync Brain.
InSync Brain, yeah. So learning about InSync Brain and what they do here and how much it affects kind of body, mind, and soul is kind of what we're interested in learning about. If it's okay, I'll just give a brief what we know about kind of brain health and fertility, which is pretty limited. And then really we'd love to kind of focus on what's done here at InSync Brain and how we think it could help fertility patients.
Wonderful.
So, and the connection part of it is that InSync Brain and Arbor Fertility are actually in the same space in Coeur. So we're in the same building, which is part of how we found each other, and we're looking forward to working with one another. So with fertility patients, I think we all know kind of the definitions of fertility and kind of the major treatments. We're going to focus on what is happening really with the brain. And we have seen overall that, of course, the brain is kind of directing everything related to fertility with the female, because we know that the hypothalamus and pituitary gland are then talking to the ovaries in terms of creating a normal kind of hormonal balance. So a lot of what is studied is actually when that balance isn't there, and then what's happening with the brain function. That's how EEGs have been done, for example, in PCOS patients, polycystic ovarian syndrome. And what they have found, and this is where I'd love to kind of hear, is that PCOS patients are not having regular cycles, which means they're not ovulating. And they're finding that they do have abnormalities in their EEGs. And it is, and this is where I'd like to kind of really deep dive, is it's probably separate than just having anxiety and maybe depression related to fertility. It is actually very specifically related to what they're going through in terms of their brain talking to the rest of their organs overall. So what we find is, and they have a different alpha, is that right? And we'll learn what these terms are.
Yeah, so your alpha wave is your resting state. So if you think of the brain like the heart is an electrical organ, and you have an impulse that starts at the AV node and causes the whole heart to contract. When you're asleep, your heart rate is slower, and when you're out exercising, your heart rate is quicker. And so similarly, the brain can operate at different speeds. When you're in deep sleep, you have delta, which is your slow speed. It's 1 to 4 hertz. And then when you're in light sleep, some people in deep meditation or in creativity can get into theta. That's the next speed. And that's your 4 to 8 hertz. And then you have alpha, which is your resting state. That's your choice state or flow state. And that's from 8 to 13 hertz. And then you have beta, which is your working state, your problem solving. That's going to be faster than 13 hertz. And so when we do an EEG in our clinic, we have you sit with your eyes closed for 10 minutes to see at rest how much alpha your brain is in. And the amount of alpha can help determine how efficiently your neurons talk to each other and communicate in order to send that electrical pulse, typically from the back of the brain to the front of the brain. And that's what allows you to connect the neurons.
So we were reading that it's the alpha and the theta that is most affected in women, specifically with anovulation and PCO. Does that sound right?
So in general, the brain can become slowed and be in delta or theta when it shouldn't be, when it should be in alpha. And so not just with PCOS, but with multiple other disorders that are related to hormones, and especially to the stress that does impact it to a degree, kicks you out of this efficient state, out of this efficient alpha, and can slow you down. Sometimes it does speed you up in a sense. You have that underlying fast speed, but you don't have a predominant alpha peak that's able to overcome that fast activity. And so in PCOS or especially when it's impacted by stress or anxiety or depression, there's usually this slowing down that occurs into delta and or theta that impacts your alpha speed.
So do you think it's additive? It is maybe some baseline, just, alteration with PCOS in addition to stress, anxiety, depression, sleep, all of it is just kind of...
All of them are cumulative. Okay. And so the more you can operate and improve each of those, they'll also cumulatively improve health and improve the fertility side of things. So the better you have sleep under control, the better you have stress regulated, the better your nutrition is. All of these things improve brain efficiency and can optimize your alpha.
So the brain fog that fertility patients speak about, which is really also kind of seen a lot more in PCO patients, but not necessarily just PCO. This is the explanation for that? Is that essentially what we're kind of talking through?
What we find a lot of the time is that brain fog and that slowed down feeling. Is the brain being in theta, sometimes delta, when it really should be in alpha? Okay. And so our treatment optimizes alpha. It looks at your particular rhythm and your brain through the EEG and creates an individualized protocol for you based on your underlying alpha speed, and it encourages all the neurons throughout the brain, especially the front of the brain or the frontal cortex, that executive thinking, that problem solving part, to operate efficiently at alpha.
So for fertility treatment, it is an extraordinary time in your life. There's lots of injections, lots of blood tests, a lot of poking. Sleep is disturbed. There's a sudden water weight that happens. Do you see that this could be part of helping with the stress?
Yeah,
with treatment?
And what we see for a lot of patients that come in, some come in and have significant symptoms. They're having severe depression or severe PTSD where they can't leave the house. Well, other people have more mild symptoms. Maybe they're just not feeling as great as they used to, or they feel slowed down, or they can't keep up with the number of tasks on their plate and managing everything as well as they used to without getting overwhelmed. And especially for those patients, we find that 4 to 6 weeks of treatment and getting the brain to function efficiently improves. Sleep is one of the first things that improves, but improves that overall bandwidth and ability to manage the stress in their lives.
Let's say they didn't have the availability of the EEG treatment, of the sleep, nutrition, exercise, kind of mental health. Where would you start? And then I guess the next question would be, do you feel like the treatment at InSync Brain would actually be a good place to start to kind of help with all of those facets?
Yeah. So I think you can approach it from either direction. So sleep is one of the key fundamental pieces and something we talk about a lot here, and really aiming for good deep sleep for 8 hours a night, but especially between the hours of 10 p.m. and 2 a.m., because that's when the brain is cleaning up and pruning and neuroplasticity happens. The best way to set your circadian rhythm is by getting bright light first thing in the morning, typically between 7 a.m. and 10 a.m. And you want it to be unobstructive, direct sunlight. And so no windows, to be outside, even for just 10 minutes can make a big difference. In the winter, a lot of times we'll use bright light therapy, which is a 10,000 lux bulb. But getting that 10 to 30 minutes first thing in the morning sets your melatonin and sets your circadian rhythm so that your melatonin peaks about 12 hours later and gets your brain and your body ready to go to sleep in the evening.
Is there a particular time of the day that you recommend exercise then?
Exercise, a lot of people don't do well with exercise just before bed, but with exercise, taking and finding the time that it fits best into your schedule is what I recommend. The actual timing of it doesn't matter as much. The one caveat, if you're waking up at 5 a.m. to go get a run in or go to the gym and it's impacting your sleep, you're doing more harm. And so you're better off with a 10-minute walk at lunch than taking and trying to squeeze in a heavy workout first thing in the morning.
What would you say to our fertility patients? Let's say folks who are kind of going through IVF, which is the more intensive treatment, in terms of what is done here at InSync Brain and how it can support them.
Yeah. So the treatment here at the InSync Brain, we start with an EEG to look at your individual rhythms and develop a protocol for a procedure called, or a treatment called TMS, transcranial magnetic stimulation. And with that, we use a magnet to gently stimulate the neurons for your brain speed. And the treatment's 5 days a week, typically for that 4 to 6 weeks. And what it'll do is, we sort of mentioned this earlier, is it improves that stress and that bandwidth. And so when things are already more stressful and you have tons going on and emotions are higher, because infertility treatment and IVF impacts hormones and impacts emotional ability. Those things typically improve with the TMS and the more so the personalized TMS with the EEG.
So it's a combination treatment.
Mm-hmm.
And it sounds like it's fairly intensive from a time perspective, that it's, for 5 weeks, 4 or 5 weeks. And so maybe it would be something that someone can plan for before they're kind of in their fertility treatment, I would say.
Yeah.
But only because, even our appointments can be kind of on the higher side. It's kind of an intensive couple weeks with us overall. So this could be a way to optimize how you're feeling during that time.
And I think that's a really great point, is taking and optimizing your mental health and your stress resilience, and being in a place where routines are in place. You feel like your mental health is in a good spot. You're sleeping well. You're dialed in nutrition and some movement. All of those things before you start IVF treatment can make a huge difference.
Awesome. Well, this is kind of part 1 of this series. In part 2, we're going to actually show you how the EEG works overall. And then are we thinking maybe even the TMS as well?
Show the
that would be really great. So we will kind of release this and kind of answer any questions that you have over time. But, this has been a really lovely kind of time and partnership to learn about it and really see the deep dive into what's really happening with your brain with fertility. Because we get asked a lot of questions, and they're really, really good questions that folks are looking into because they feel so different overall. And they want to get back to their normal self, but how about we really optimize it so they're, kind of in their more elevated time is what I would say. So thank you so much, Dr. Buchalter with InSync Brain, Psychiatrist.
Yeah.
And we really appreciate everything in terms of having us over here. And until next time, thank you so much.
Thank you.